My name is Lapkin, and I am the Senior Vice President for Global Strategy at SmartLogic, which is a company that makes semantic software.
And what's the benefit of your company to the general population here, the life science community?
The thing that SmartLogic brings to the table is the ability to actually utilize and extract the human intelligence from all of the scads of research archives that have been created over the years and which currently are not being used.
That's a lot of diving in and pulling out of tech.
The idea is not to dive in and pull out, but actually to make that information machine processable so that machines can be used to extract the value for research scientists to use.
That's great. Now I know that you were on a panel and also spoke about various topics yesterday.
We talked about content intelligence and the value that it can bring to the research process. Content intelligence is the combination of technology and information science that allows you to model, interpret, classify, analyze, and visualize all of the content that you have, which is about 80 to 90% of the information that you have in your enterprise, and it's growing by more than 50% per year.
That's a tremendous number. What do you feel is the takeaway point?
I think the takeaway is that people need to understand that we now have the ability to leverage the value of our content in the same way that we can leverage the value of our data. We haven't been able to do this up till now because technologies for managing unstructured information have lagged well behind the technologies for managing structured information and big data. Now we're at the point where we can actually use that information and shorten the research cycle and cause earlier attrition for drugs that are going to fail and do things that we were unable to do before.
That seems to be the theme, is try to shorten the cycle.
Shortening the cycle is important. It costs, depending on who you believe, somewhere between $1.8 billion to $4 billion to bring a drug to market today. One of the reasons for that is that the ratio of compounds that you start out with is very high compared to the ratio of compounds that you end up with. So the earlier you identify that a compound is going to fail, the better off you are. If there's information in your previous research projects that will allow you to make that determination earlier, then you've brought tremendous value to the research process.
So you have a valuable tool for the pharma folks to use.
That's what we believe, yes.
Last question. Here at these seminars and symposiums, what do you think? What do you think of today's symposium?
It's been very, very interesting. The attendees are professional people. They are professional researchers. They're clinical pathologists and bioinformaticians, not technology people, and that's very refreshing to see.
Okay, very good. Well, thank you very much.
Thank you very much.